percent of patients come from outside of the state of Maharashtra. That's the kind of trust and faith people have in this hospital. Next slide. And I've been a part of the Lancet Oncology Commission, which has evaluated what should be done. And we clearly know that there is lack of cancer surgery investment. I mean, we can also say there is lack of, you know, that our medical or health expenditure GDP is so poor. It is so poor that it's embarrassing when you compare it with even Sri Lanka and Bhutan and Pakistan. So if it in America it is 17.6, India is 2.1, or correct me if I'm wrong. We are so bad today. So the task of producing just doctors and nurses itself is a massive one. We are not there, and that's why we are all overwhelmed. The doctor-patient ratio is poor, the nurses-patient ratio is poor, and on top of that, there is no investment if you want to really be prepared for the next 20 years. So we know what's happening. LMIC would mean that India belongs to the group of low and middle income countries, and in 2021 the LMIC spent $1.9 per person. This is the ground reality. In the United States it is 2.7, and in LMICs, in the low income countries it is 2.7, and then you will see in the upper income countries it's US dollars 8.15. So if US dollars is spending 8, we are spending 1.9. That's the kind of difference. I'm not saying that they are doing the right thing. There are enough wrong things with the US healthcare system, and there is a lot of wasteful expenditure as well. So choosing wisely, thinking wisely, and doing something better is our responsibility as LMIC, but clearly we lack in investment. So these are some of the challenges and the economic impact that you will see even more in the next 10 years that's coming. Next slide. 1996, the blue color is number of registrations, 25,000 patients in Tata. We already are approaching 80,000. In the pandemic year, in 2020, we saw 62,000 patients despite a national lockdown, which just tells you what must have been. It is terrible, and this despite we opening a new hospital in Varanasi, which already within 3 years sees 15,000 new patients of cancer. So these are not the patients of Tata Hospital who have gone there closer to home from Uttar Pradesh or Bihar. These are patients who would never come to Mumbai in the first place. Now they at least have a chance to go there and get treated. So these numbers are increasing. Obviously the number of beds are not going to increase that easily. We have a space crunch in central Mumbai, and it's not easy to get things sanctioned from the Department of Atomic Energy. Just for those who do not know, we do not come under the Ministry of Health. We come under the Department of Atomic Energy. And that's in a way good because we are relatively free of any political interference. We directly don't come under the Ministry of Health, but we are a grant in aid central government institution. We come under the Prime Minister's office. This is like the Tatas built it, but then they transferred everything to the government in 1962. The hospital came up in 1941, thanks to the vision of so many. I can give a whole talk about history of Tata Memorial and the Tata family, but some other time. So today, 4.5 lakh patients come to us a year, and then by 2050, I expect that's going to cross 10 lakhs. And in addition to this, there are new patients, and in addition to this, India is also going to get more and more older in terms of a geriatric population. If a child lives the first 5 years in this country, India's life expectancy already for the past few years is 75. But if you just look at the overall figure, we were 64.9, now we have reached 69 point something. So we have improved in the last 1 decade, no question. But those who survive the first 5 years, in modern day India, 75 years is what you will get. So you will start seeing many more people, the older generation also with cancers. It's an environmental disease, and so you will also see a younger population, which is the strength of this country. So we are going to be in difficulties, and we should be braced and prepared for it. Next slide. How do we do this? Now this is the ground reality again. Again, I've been a part of this publication in Lancet. 42,000 patients were treated by 188 staff at Tata Memorial in Mumbai, compared to 41,000 patients at MD Anderson treated by 1,700 staff. So it's not an easy task. We don't need to reach 1,700. So all of us who have been abroad, you sometimes feel that they don't do it. So we don't need perhaps so many, but we clearly need more people, and we need to keep them in the system. We need to motivate them. We need to encourage them. They need to feel the desire and the drive to be a doctor for the right reasons. Then we need to prevent attrition. So this is not easy, as you all know. Next slide. Do I see this as a challenge? Yes. And do I also see this as an opportunity? It depends on how we look at life. So I look at it also as an opportunity. So when we plan a cancer center, these are the areas that we will need to do that. So we are working with our Department of Epidemiology and Cancer Statistics, where we would know where is the drainage area for which type of cancers. We would see whether we can think of doing selective screening of cancers in regional pockets. Screening as a concept has not as yet scientifically been proven consistently to be superior. A lot of discussion about colorectal cancer and some other cancers, but simpler forms of screening for breast cancer, etc., are proving to be very relevant today. So you need to have data. Do we have data in our country to really know which pockets, which part, what is the etiology, what are the types of cancers, what are the numbers? We are struggling, we are basing our homework based on a number of registries, but we are far from being perfect, so we do not know the real numbers. We are working on training people, as I told you, Tata. We'll try to develop guidelines which are more relevant to what we practice daily than what would be just printed in one of the first world countries. A lot of those things we practice and we have to practice, but we also have to balance the aspect of financial toxicity and then find a way forward to help our individual patients. And then of course we need to see how we can finance them, how we can improve. So I've also looked at possibilities as to how we can try and encourage people as regards insurances. We all spend a lot of money on our holidays, on our whims and fancies and weddings and everything, but a large number of educated people do not take health insurance or cancer insurance. It's a shock to me. 75% of Indians continue to have out-of-pocket payments for management of cancer. Only 25% of the patients who are educated who come to us have a degree of insurance for them to withstand financial toxicity. Otherwise, a large number of them are really in trouble because expenses are not going to come down. They're only going to go up, is what we clearly know. However much you indigenize and make technology easier and cheaper and accessible and available. Next slide. So to that effect, we have established 6 hospitals. There are 2 in Varanasi and they are doing excellent work. So you have bone marrow transplant, you have GI surgery, you have head and neck cancer surgery. 33% of the world's head and neck cancers are only in India. It's a thing of shame and it's a thing of sadness because the United States has 2% of the head and neck cancers in the whole world. So they will make tobacco and smoking fashionable, and we will take that smoke and we will continue to use tobacco. And if you just somehow control tobacco, you will actually clean up this country like nobody's business. 33% of the world's head and neck cancers are only in one nation. We need to see about this because it's all related to money. So of course I love and enjoy having a meal at the ITC, but we should be aware as to what are the sources channelizing, getting these ITCs all over the place. We should be consciously aware of that. So 6 hospitals, 1 in Vizag, 2 in Varanasi, 1 in Guwahati. Sir,
just a small interruption, Doc. When you said 33% of head and neck cancer is isolated,
in India.
In India, is that a direct connection to the use of tobacco?
Absolutely, 100% direct connection to the use of tobacco in its various forms, which we in our country do.
And there is no difference whether it is ingestion or inhaling?
All is bad, unfortunately. unfortunately. That's the reality. So, and who is getting affected? The poorer strata. The rich people are getting affected because they have the money and they need some addiction and they get used to it. But the poor people, the laborers, the people without rights, the people who have a terrible life to lead, they depend on tobacco, and that's being sold when we know that this is only harmful. So we as a society truly need to introspect with our conscience as to what are we exactly doing. So that's the ground reality.
We must suggest this.
So we reach a stage where we have got a hospital in Guwahati, Vishakhapatnam. That's me operating in Varanasi 3 years ago. That's the hospital which was inaugurated by Mr. Modi. Mr. Tata contributed in a big way for building the hospital quickly, but the entire place has been handed over to the Department of Atomic Energy. So why is this being done? We want to try and develop the hub and spoke concept. Everybody coming and staying here is not our goal, and we telling that we are big and we have a long waiting list because we are highly skilled and capable is not the way for a country which lives in different centuries at the same time like India. We are a unique nation by any standards. Next slide. What have I done? I became a deputy director in 2018. What have I tried to do? This is your recent photograph with your team of Rotary. We've just signed an MOU. I managed to convince the previous government that it's one thing to keep on talking about people living outside of the pavements of Tata, but people don't understand that to rent out a room per day for the poorest of people, it's going to cost you nothing less than 1,500 rupees in the vicinity of Tata just to stay. So a number of people who are on the pavement because they can't afford 2 months and 3 months of treatment in Tata and then go back to their homes where their kids are perhaps with the grandparents or with neighbors because the husband and wife are taking treatment in Tata. This is the ground reality. Many of you with golden hearts are truly supporting them and participating in that. The Gurudwara is doing amazing work, the langar over there for years together. So Tata is very grateful to this kind of support from the NGOs to keep the whole institution running. So we did manage to convince the previous housing minister, and they have given 100 flats to us. They need to be done in a way that they are patient friendly, and so that will be done. We've signed an MOU with Rotary and HDFC, and this will be up and running very soon, very close to Tata. It's a drop in the ocean that we are able to help 100 families, but that's better than being a part of a problem. I always prefer to be a part of a solution, and this is one step. Thane Municipal Corporation and a Jito Trust, they have also approached us because they had developed a 1,000-bed COVID center just beyond those properties of Rustamji as you head out of Thane to go towards Bhiwandi and on the Nasik road. Just where you have this pre-Balko. So I've been there, and they decided that they will make it into a cancer hospital now to help Thane and the entire area. This will not be our funding. This will not be a DAE project. We will just give them consultancy and guide them as to how Tata Hospital is run, so that we can help them to kind of have a model which is very similar to what is being done here. So that standard treatment, people don't have to travel all the way to Mumbai. They can just travel there and get treated. So that's what I'm doing in Thane as well. I've also gone to Nasik to try and help this Guruji Rugnalaya, which is also doing outstanding work. Again, all institutions which are trying to do their bit with a social cause. That's the start. That's what I know Tushar is. Thank you. So we have come to a situation where we'll try to do something in Nashik, we'll try to do something in Aurangabad, we'll try to do something in Thane. We will continue looking after this cradle because Parel and TMH continues to be the cradle of oncology in India even today. Next slide. I was Mr. Krishna Kumar. I decided that in addition to pancreatic surgery and everything that I'm doing, it's also important that you develop some specific abilities to try and be an administrator. just because I can drive a car or play some games of cricket well and operate well doesn't mean that you can administer very well and run a hospital. So I decided that I will spend some time in Harvard and I applied for a course. This is something which inspired me because Tata Trust got to know that I am planning to go, and in just one email Mr. Krishna Kumar funded my entire course in Harvard, saying that they are aware as to what work we are doing. So I also say that without anything we just keep on doing good work. Somebody is somewhere watching what you are doing, because this was a shock to me. I just landed in Brazil in the morning and in Belo Horizonte, and I went to the hotel room and I got connected to the Wi-Fi just to check messages, emails, WhatsApp, and one message comes from Mr. Krishna Kumar from Tata Trust, and that's written to Dr. Barve that we know about him and the money will be transferred by Tuesday. I was there on a Friday and Harvard was done. Otherwise I was actually thinking that this is some serious amount of money, how am I going to manage this? It was my own last bit of learning. I spent some time there, and this is something which will inspire any one of us, and I need to get closer to that to read it out to you. I'll read it out to you. In honor of Ratan Tata, an architect of global growth. Where's the lab? Vaibhav, you can read it out? Give it to me, I'll read it out. Because I think it's important. Yeah. It's very important. I'll read it out to you. In honor of Ratan Tata, architect of global growth, role model of social responsibility, advocate for new technologies, with respect for the past and a vision for the future, he is an exceptional leader and a role model for all who aim to have an impact on their companies, countries, and the world. So there's that entire building where I've taken this picture. That entire building is the Tata building in Harvard. Wow. So it inspires us enough when you get there to realize that there is so much more that we can keep on doing when you look at this. So it's always about stepping out of your pond. Next slide. This is what I wanted to tell you, that in the first 5 weeks of COVID, we went into a lockdown, I think on 22nd, 23rd March, and we took a conscious decision, we will not stop cancer treatment. Yes, we will cut it down, we will have selection bias, we will take younger and fitter patients for surgery, we won't get into patients with multiple comorbidities and major complex chemotherapy which will threaten their immunity even more. But still, even if you have a case selection, we have enough patients to treat, and that's what we did. But as far as surgery was concerned, 85% of these surgeries were major surgeries, grade 3, grade 4, grade 5. 15% were less than grade 3. And we did not have a single mortality. Of course, the care was taken. But this kind of became a guideline globally, because we published this within first 5 weeks in Annals of Surgery, one of the better ranked journals in the world of surgery. And it became a good idea for people. So we led that way also, in a way that we can take it ahead. Go ahead. Yeah. As I come to the end of my talk, this was where I was at the, at the Bhumi Pujan of this building that you see today. If any one of you goes to the Hafkin campus, it's already complete and doctors and nurses are staying there. Those of you who are doctors know the reality, but in Tata Hospital even now, the old hostel, you will have people who are already MS or MD, and they are 28, 29. Some of them are married, some of them are engaged. But 4 doctors in one room, which has 2 beds, and because of lack of place. And this has been the reality for a long time. And now we have super specialities. So people literally take turns. And then you have the bathrooms which are at the end of the corridor, non-air conditioned, of course. I've gone through this in Sion, but that is 3 years of MS. These are people who have already done MS, MD. The world has changed. So this is our conscious effort to try and improve things, that these are now rooms with attached baths. The ACs are going to be there, and only 2 people per room. Everything will be connected with telephone. This we need to do. I know the doctors don't get much time to be there, That's not supposed to be. They are not supposed to be there. They are supposed to be in the hospital. But we have done this both for the doctors and nurses. So Dr. Badwe had made, my director is Dr. Rajan Badwe, who is the overall director of all these hospitals across the country. And we've done this and it's already up. Identical to this building, we are coming up with another Dharamshala. So apart from the 100 Mada flats, we'll have about 200 other flats which are like studio apartments. For whom do we do it? There are some cancers which require complex treatment with chemotherapy, for example. And in such a situation, it's very important that they get treatment. We can't give them a prescription and tell them that you go back to Nagaland or Guwahati or Tripura and get your treatment done there. These patients need to be in Bombay for 3 months and 4 months and 6 months. Pediatric cancers is very traumatic, but on the other hand, if treated well, they get completely cured and live long. So they also need good treatment and good support system. So these 200 flats will at least help 200 families who are here for long duration treatment. This is actually all a state responsibility, but Tata Hospital has never functioned like just as a hospital. So this is our bit where we will try to develop this facility, and it will be up next year. Already, I think how many slabs are over? It's nearly 12 are complete out of 15. So a mirror image of that is already there again on the Hampton campus, and lots of well-meaning people who are opening up their pockets to also support. I must acknowledge Mumbai Municipal Corporation, they gave us a CSR of 40 crores to build up the Dharamshala. So that's also ongoing, lot of work beyond patient care and surgery. Next slide. And this is a dream, and it still is unfortunately a dream, but I hope it becomes a reality. Dr. Badwe told me in 2017 that our existing building is not a heritage site, but the existing building is going to be 80 years and more, and we have structural issues with the existing building. Any hospital which is already functioning, it's very difficult for us to stop that hospital and build something on top. In other words, if you utilize the FSI, you have to utilize it one time and do it from ground zero. Because the present Tata hospital that we have, to cut the long story short, we have about 3 main buildings built in 41, 82 and 2011. The total area of all these 3 buildings together is about 7,44,000 square feet. What we are planning to do is a 17-story building with maximum permissible FSI. Special permissions taken to have a building of 17 stories, because after the fire of the hospital in Calcutta, the rules are very strict as to how high you can go. But Tata has got an exceptional waiver officially. All permissions and approvals, it was an education for me, as I shared with you. So I actually have been to various offices and understood what it takes. It's not my job, but fortunately Tata is still managed by clinicians and doctors as well, and not controlled by just an administrator. That's the good part of Tata. So we've got all permissions in place. The DAE has given us 450 crores to just build the civil and the MEP part of it. I cancelled one tender, then I got a global tender, because we want to build a hospital which people will find it hard to believe that a government can build a hospital like this. Otherwise, the typical association with a MHADA or a government hospital is very different from a Lilavati or an HM hospital. But it's possible, it can be done. It's a lump sum contract. I've got a contractor also in place. There are some challenges at the Atomic Energy Commission level, so it's right at the doorstep of Mr. Modi. I don't know, I'm waiting for the last 6-7 months to get the final approval. But the project cost has increased, so from 450 with more FSI, more floors, the area is going to be 11.5 lakh square feet. So if Tata today is 7.5 lakhs, we're going to have 11.5 lakhs of more space. That's where I say that we are trying to be prepared for the next 10 years, 20 years, 30 years. Only 6 specialties will be there. The good part is, let a poor patient come or let a well-to-do patient come. The doctors won't have to run around much. The central area would be managed well, and yet there would be complete segregation. Why segregation? Because our country is still a few decades away from being just one country. People still, Tata's, the good and bad part of Tata is that a private patient feels it's a government hospital, and the general patient feels that this is like a private hospital. That's the uniqueness of Tata. That 60% of patients are poor and we can help them with the same surgery that I learned in Hyderabad. Today, I've done a free patients operation, same instrumentation, same technology, same results, the works. This doesn't happen anywhere in this country, I can tell you on an official platform. So this is the dream, it's all designed, permissions in place, and we have managed to perhaps raise 390 crores through CSR already. So it's an 840 crore project. If I get the permission, I hope that I can discuss with you the next time you call me for an 840 crore hospital 5 years down the line to share with you as to what we can do. Next slide. Surgery continues. That's our GI team over a period of time that we have kept on dealing. So it's not just about the physical structure. Inspire, stay inspired, teach, transfer, and motivate more people to do work as well. This is what I genuinely believe will be my contribution and our contribution towards surgery research and education on behalf of Tata Hospital. Next slide. And of course, we all, those who are doctors know how it feels. At the end of it, all that you want is a patient who is truly grateful to you for what you have done in a very happy way. So these kinds of things continue to drive me. The numbers, because we used to do 25 and now we do 300, and because we do them with world recognition, the gratification or the satisfaction that comes from every single patient's genuine wishes is something which will continue to drive us all the time as we go ahead. Next slide. Thank you. I think I exceeded my time, but thank you so much for your kind attention. No, Tushar had told me 20-25 minutes, so I have exceeded your time. My apologies.